Sequencing may no longer be the bottleneck in precision health. But if that's true, then the real question becomes, what is? So in the last episode of Precision Health Decoded, I explored the idea that the constraint may be shifting from platforms to infrastructure. And in this episode, I wanted to take that one step further. Because if infrastructure is the constraint, then decentralization becomes the question. What would it look like if genomic technologies were not confined to centralized labs, but instead became portable, accessible, and embedded directly into care? To explore that, I sat down with Gordon Sanghera, co-founder and CEO at Oxford Nanopore, at the recent 25th Annual Precision Medicine World Conference in Santa Clara. And what makes Gordon's perspective particularly interesting is that his work in decentralization didn't begin with genomics. Long before nanopore sequencing, he was working on bioelectronic platforms that transform diabetes care, helping to move glucose monitoring out of centralized settings and into the hands of patients. And that shift from centralized testing to real-time distributed measurement fundamentally changed how a disease was managed. And it also raises an important question. Are we approaching a similar inflection point in genomics? What emerges from this conversation is not just a story about sequencing, it's a story about how technologies become usable, how they scale, and what it takes to move from innovation to real-world impact. Here's my conversation with Gordon Sanghera.
I fell into a PhD. I was solving a very major problem, which was I was expected to get an arranged marriage. And so, as with a lot of Asian parents, they also wanted me to be a doctor. So I thought I could kill two birds with one stone and become a doctor, not the kind they thought I would become, a PhD, and delay the pressure, as I was the oldest of four, and the first to go to university, delay the pressure of getting married, getting an arranged marriage.
Wow.
And
Wow.
because I was already with my now wife, and we were partners, but it was all very secretive. I actually fell into bioelectronics, so coupling biology to electronics, and which is a theme that has carried on into Oxford Nanopore, which is also bioelectronic sensing. But if you go back and think about the late 80s and type 1 diabetics, home testing was not a thing. It wasn't even clear that strict glycemic control was important. And there's the famous 1986 Framingham study where they first started to realize that those with tight glycemic control could minimize complications that you get from long-term type 1 diabetes and you know, glucose levels fluctuating high and low. So what Medisense did, spun out in the mid-80s, was to develop a bioelectronic glucose device which could be small, portable, easy to use, fingerstick device, little plastic strip. And it really is actually a great example of distributed precision health. And this is, as far as I'm concerned, a peek into the future. Because when we make things affordable, accessible, and easy to use, and they're meaningful to today patients in the context of type 1 diabetics, but ultimately our lifestyles, our longevity, our future health, our preventative medicine strategies, which are all wrapped up in precision health, will become easier to manage because we will have a much better handle on the multi-omic drivers of disease. I didn't understand that when a patient knows their blood glucose is critically important to their health, and they can have a feedback loop with the glucose sensor, they would interact with the technology.
Sure.
And they did. And today that has morphed into implantable 2-week sensors, which was the original concept in a patent that was filed 45 years ago from Professor Alan Hill,
Wow.
who pioneered this bioelectronic technology. So it gives you an idea of what a disruptive
huge.
technology takes,
Absolutely.
how long it takes. That glucose sensor is built in the UK at an Abbott facility. Abbott acquired the company. Generates in excess of $5 billion of revenue per annum.
Wow.
For the betterment of type 1 diabetes, human
Yep.
health. And it's radical and it's game changing. And it really shows that when you hit a disruptive deep tech, it's around for a very long time. It morphs and it evolves,
Yep.
but it's around for a very long time.
Yeah, that segues beautifully into nanopore sequencing technology. It's often, it is referred to as DNA sequencing, but in fact, it's an electrosensing platform. Can you share how you segued from the diabetes monitor into the nanopore sequencing with you and the founders?
Indeed. So we built out Medisense. We built a factory to build and manufacture bioelectronic sensors and instruments. In 2004, it had been 7 years Medisense and 7 years Abbott, and I not really enjoyed being in a big company, great company, but it's just not me.
Yep.
Need a bit more freedom. And I also felt that from a UK's perspective, you could add to the long list Medisense, Celexa, monoclonal antibodies. I mean, the list is long and deep where we let technologies get away without properly monetizing and getting a return on investment for the academic work that's done. I was looking around and I'd kept in touch with Oxford Tech Transfer, where Medisense came out of, and often gave talks. And I came across Hagan Bailey's single molecule electronic sensing platform. And what I noticed was there's a lot of parallels in terms of scaling and manufacturing devices. The model could be very similar, finger stick replaced with a much more sophisticated electronic measuring platform. But nevertheless, a lot of things where I could see how to scale. And actually what we did, although we said we were going to have to buy polymers, we spent most of our time scaling first. We worked out how to build a scalable, affordable, consumable instrument model. And then we started to work on sequencing. At Medisense, I'd had positions in research, development. I ran their IP. I did a lot of technical marketing, but I'd not been CEO. So when I went to Nanopore, and when I looked at the work from Hagan Bailey at Oxford, with Spike Wilcox, who's from a VC fund and my co-founder, I realized there was a lot of scaling that could be transferred, very similar but far more sophisticated. To put it in context, a glucose strip is one channel. This was hundreds of channels.
Got it.
We were measuring microamps, and we needed to measure pico. That's 1/1,000,000th the amount of electricity flowing through a light bulb. So it's it's a bigger challenge, but it's still a bioelectronic platform.
Yeah.
And I kind of figured, even though it's one of the hardest platform technologies I looked at in that period, my background would allow me to become CEO. With a view that I would have probably the same sort of tenure as a Premier League soccer manager, which is two to 4 years, maybe 5 years. I mean, the greats, Sir Alex Ferguson and Arsene Wenger, lasted 14 years. So it's still shocking for me to think I was around for 21 years from inception. Because we knew what we were building, we had a clear idea of a platform, and it's both centralized and portable handheld.
Yes.
We focused on developing the platform, and then we layered the applications on top. So we demonstrated just when the company was started the prof had demonstrated that he could take GTAC, the 4 bases, and independently read them with 100% accuracy. So you had clear blue sky between each current level.
Yeah.
So, how hard can it be? We were going to put an exonuclease on top of the pore, so that it would basically a pair of molecular scissors. It would cut the bases, they'd drop in, and we'd sequence. And then you learn some pretty amazing things. I talked about a millionth the current of a light bulb, but if you look at the area, the constriction, you're at 0.6 nanometers. So that is equivalent per unit of area to a thunderbolt.
Wow.
And you're asking this really delicate exonuclease to, you know, which is there at the part of nature's repertoire to just cut out some pieces and take them out, right?
It's brilliant.
And
Wow.
and at the same time, I mean, we were spun out of Oxford, but we'd also partnered with the godfathers. So that was Gene Golovchenko and Dan Branton in Harvard.
Yep.
Gene had built the atomic scanning tunneling microscope at Bell Labs, and Dave Deaver and Mark Akerson in Santa Cruz. Gene kind of just decided, because I'm an electrochemist, I was some sort of brilliant mind like his. And he'd sit there and over a beer he'd say, let's talk about Debye-Huckel theory. I think it falls apart at the aperture. I've seen molecules that are hundreds of microns away being sucked into the nanopore. And I'm sitting there thinking, well, this is all very flattering, but like, you know, I mean, I know Debye-Huckel theory, I understand diffusion, but all of that goes out of the window.
Sure.
Because that's all based on ensemble measurements. So when you're at the single molecule level, some pretty weird stuff happens.
That's
and we
incredible.
don't really properly understand it.
Yeah.
We could not get the exonuclease to work. And to this day, we know why, but we all signed a blood pact that we would never explain that to anybody. Because people will probably work it out and probably make exonuclease work.
Sure.
So every day on the way to work, I used to listen to This Could Be the Day by The every day.
Love it.
It was just like that. It was going to happen. But what actually happened was we were funding Hagen to try and just show that if we were looking at strand sequencing rather than cutting the exonucleases, and David Stoddard, who went on to be, is a very successful R&D technologist in nanopore today. He demonstrated that a stationary strand where you took the constriction point and put in a G, a T, an A, and a C, standing 0 miles per hour movement, you could see reasonably clean correlations to current levels. In Santa Cruz, Mark Akerson and Dan Giraldi, who is also a long-standing technologist with Oxford Nanopore, his career built there, he demonstrated that you could use a helicase to translocate. We brought the two together, and this time it worked in 90 days. And we'd spent 3 years thinking it would happen in 3 months with exonuclease sequencing.
Wow.
And that was our phoenix rises from the ashes.
Absolutely.
So, you know, it's a classic Steve Jobs thing. We launched it with minimal viable performance. And to this day, people still say, is your accuracy any good yet? 10 years since we launched products. But it was the right thing to do. And in the hands of the users, they very quickly latched on to rapidly mutating infectious diseases, for example. And that was in and around 2011. And in 2012, Clive went to AGBT and presented some data on Phi-X. And it was a fabulous moment.
Wow.
The stocks for all the big sequencing companies dropped by about $1 billion for a day. It was a moment.
That determination around being disruptive, which is your signature, and decentralization. Can you talk a little bit about how this technology has really outperformed the other similar platforms to the extent that you can decentralize it, and the difference that it's made, across the globe?
Yeah, I think just being disruptive is just something. I think I must have been a terrible. Actually, as the oldest, I had a bit more responsibility, but I was a terror. I took toys apart. I broke everything up to figure out how it worked. But what really shaped me was my blood glucose experience, because that is a tangible device interacting with a patient in real time, 4 to 6 times a day. I mean, it's continuous monitoring now, and that distributed model has radically transformed the lives of type 1 diabetics. And so when I came into sequencing, I just thought, and still do, and it still is, it's a bit, we're in a mainframe moment.
Yes.
It's very centralized, the preserve of rich nations.
The central lab model.
And medicine and information, and at the same time, you were seeing people going to the doctors with Google symptoms.
Yeah.
And I just think that and everybody said, this is terrible. We're all going to turn into hypochondriacs, and nobody's going to ever go to work again.
Oh yeah.
Remember that?
Oh my gosh.
So that didn't happen actually. People got savvy.
Yeah.
They started to make medical practitioners accountable.
Yeah.
And that, when I looked at genomics, I thought, now if you could take that to the genetic level, because now it's real, and that I still feel strongly will be transformative, but it has to be decentralized, it has to be distributed, it has to be affordable, and it has to be accessible. And if anything, the pandemic taught us was absolutely that's. I don't need to say any more than that. I used to spend a lot of time trying to explain why it was important.
Absolutely, but to that end, share with us a couple of those examples where this platform, because of that decentralized capability, how that did make such a big difference in the pandemic. For example, the work that was done in Africa at that time.
Yeah, so as we headed into 21, an international investor came in, put some money in alongside a partner fund, which saved our bacon. And then the pandemic hit.
Yeah.
We shipped 200 handheld MinION sequencers to Wuhan. And I think still to this day, the Chinese CDC use it as their first line of defense. And the first genomes were done on MinION in Birmingham by Nick Lowe. And when you look at the distribution, 60% of all genomes in India, 83% of all genomes in Africa, the affordable, accessible model really shows that you cannot and you must have genomic equity.
Say a little bit about methylation. We have to acknowledge the uniqueness of the platform in capturing not just the genetic code we're born with, but what's happening here and now, and how that technology can be deployed in a much more preemptive, preventative way for population health.
So I'm going to be quite bold and ambitious about what I say next.
Okay.
In the same way as the lithium battery electrified the world, you use lithium batteries on multiple devices all the time. Sometimes technologies define eras. And with methylation, when I was looking and doing my due diligence on Oxford Nanopore, Hagan Bailey showed me a paper where you could see the carbon change to hydrogen one atom. And he said, see the signal there, that's C, and see that change in signal, that's C prime.
Love it.
And I said, what's C prime? He said, that's methylation.
It's methylation.
And this is like 2006,
Wow.
7.
Wow.
And also, what I'd read through all his papers, what really struck me was, he had this paper where he demonstrated with the same sensing element in the nanopore, you could look at R and S ibuprofen. It's just like, it's mind-boggling.
It is.
It's the same sensing element.
Yeah.
This is how sensitive this technology is. And that, then I started reading about methylation, which is great because I'm not a geneticist, I'm a chemist. And so I could get my head around a carbon, changed, a hydrogen changed to a carbon. And the more I looked at it, the more I realized that methylation has a huge role to play. And you've done a lot of work around long COVID and cardiovascular disease. So it's not, everybody associates methylation immediately with cancer, and that is important, and that's where there's great correlations. But I think that we are entering the era of the methylome.
Yes.
And I think the C base will be dominant. I said in a fireside chat yesterday at Precision Health that it's a bully. So this is called bully. It bullies all the other bases because it does.
It does.
Because, it silences genes, it switches things off when it shouldn't. It plays havoc with your immune repertoire.
Absolutely.
And so I'm really excited, and I think methylation will define a precision medicine era coming very soon.
Share a couple of your proudest examples of how the technology has been used and deployed in the clinical setting.
Before I do that, I've got to do one other favourite one. So as a child, I just about remember the moon landings. And I was actually reflecting.
We share that.
Yeah. I was reflecting, actually lying awake in San Francisco on the West Coast, as you are at 4 a.m. In 2015, the MinION was on the space station. And we did our London calling dinner. We got a phone call from the International Space Station.
It's incredible.
It was just one of those moments.
And incredible.
And for NASA to adopt a technology that I'd had the privilege to be involved with, and not just in space, but they have a program called NEMO, where they were looking at extremophiles in the Mariana Trench to see how these species survive.
Right.
They then covered 7,500 new species, unknown.
Incredible.
But clinically, which is really important, it always is about clinical applications of our source code. The one that really strikes me and embodies and encapsulates all the things we do, which is portable, real-time methylation profiling of tumours. And the one that is literally mind-blowing is interoperative in children with brain tumours. They take a sample, and in a 45-minute turnaround time, using methylation only, they can classify the tumour, and it guides therapy. I mean, that to me encapsulates everything: rapid, real-time, C-based methylation.
The value of methylation.
Tumour profiling from 6 weeks to 8 weeks to immediately, but that playbook will be played time and time again.
Absolutely.
Acute myeloid leukemia is already happening. There are many areas where nanopore sequencing is now starting to penetrate and become the dominant player in rare disease, because it's multi-omic, because we have short, long, and ultra-long reads. We can look at copy number variation, which we know is linked to many diseases. We can look at structural variation, where we're really only starting to understand how big a driver it is, not just in neurodegeneration, where the smoking gun sits
Yeah.
neatly, but in cancers as well.
Absolutely.
And when you combine methylation, copy number variation, structural variation with SNPs and SMVs, and you start to get a more comprehensive picture,
Yeah.
and then couple that to AI
Yes.
as an enabler, not a driver.
Yes.
Pay attention, everybody.
It is an enabler.
AI, biology is not a subset of AI.
Yeah.
Just remember that.
So if what glucose was in the 90s, what genomics was, let's say, in the 10s, we've talked about methylation as the next, really big omic to begin to change population health. What do you see as some of the other omics that we should keep our eyes on?
I think two things. I have, a few days ago, stepped down as CEO of Oxford Nanopore after a 21-year run.
Yep.
So very happy with that. So let's see who can break that record.
Congratulations.
But it's been an incredible journey.
Yeah.
And I have met and worked with some of the most brilliant people. And when I think about what's next, and I'm excited, and the reason I'm ready to leave Oxford Nanopore is for me, all great stories are trilogies. I'm completely obsessed with Lord of the Rings.
Of course.
And the third act is coming.
Mm-hmm.
And I rode the electronics wave
Yeah.
with blood glucose, the genomic wave, and what's coming next is this confluence of multi-omics, not just methylation, direct RNA modifications as well, machine learning AI,
Yes.
and our ability to edit DNA. Those three are going to come together,
Yeah.
and it's going to be a perfect storm. We have all the tools to generate this depth of data in a multi-omic way, using AI to accelerate associations to disease.
Yes.
We now have electronic patient records. It's
Yes.
all interlinked.
Yes.
And that is going to create, and it's about right, it's 23 years since the first human genome was done. It usually takes about 20 years for a technology to come
Yep.
from the early promise
Yep.
to rapid breakthroughs, and we're seeing that.
Yes.
And I'm really excited about that, and excited about, if you like, crossing the divide from being a platform developer to being a content creator.
Love
And
it.
I'm going to have a lot of fun doing that.
Content creator and then deployment.
Absolutely.
Broad deployment.
Absolutely.
I'll ask the last question. If, what an incredible history and career you've had. So congratulations again. If you could do anything different, what would that be?
Probably, I definitely should have left medicine earlier. And I don't feel it at the moment because I feel I could do more at Nanopore. But I will probably look back and think I should have left Nanopore earlier as well.
Yeah, to get
And
to this
to do the next thing, yeah.
Yep.
Yeah, but not much.
Yeah.
And it's, it used to be a kind of joke in my head, me, myself and I, that I would continue to disrupt and break optical systems because they're cumbersome, they're complicated, they require fluorescence tags and cameras. Electronic measurement systems are easy, fast, low cost, which allows you to have the distributed models we want. And I think that is something that will continue.
Absolutely. Wow. Gordon, thank you so much for your time.
Thank you.
Precision health will not be built by technology alone. It will be built by systems that turn data into decisions and decisions into care. Thanks for listening to Precision Health Decoded.